Midday report. Let's go a little bit more in depth into healthcare. Not my ideas. I'm no expert on this stuff. This is from Karl Denninger, pretty genius businessman in the technology area. He does a lot of writing. You can find him at marketticker.org. Of course, there are the links up there that I've provided for the story I'm referring to, as well as two essays that he references. One is from the New York Times, and he's responding to that. Only a little bit of a response. It's more him getting his own ideas out and using the New York Times as a launching point for that. And then his, from about a month and a half ago, his real solution for the whole healthcare crisis, which mostly involves basically cutting administrators and quite a few other solutions as well. I can only sort of whet your appetite to read that. I can't do much. If you want to handle your healthcare with something a little bit lighter and feel like, hey, you've really looked into it, I can mention a certain video from a certain woman with long blonde hair. You know, it's very cliched and cheerleading-y, but it says, hey, Trump's doing the best you can. You can feel like you've really looked into the healthcare debate if you want to look at that. And plus, it features the person providing you with that valuable information in a low-cut dress, which is reminiscent, sort of, someone mentioned this, of Bo Derek's outfit in the movie 10, at least the one from which the stills were made that are most famous. So you can do that, but we're going to look into what Karl Denninger has to say here. And again, not my words. I give credit where credit's due, and it's rarely my words on here, but that's okay, because the point of this is I see myself not as someone who's descending from the heavens to enlighten you with my wisdom, but someone who can direct you, if you're so inclined, to what the sources are of real experts, really intelligent people, and what they have to say, and maybe I can lead you that way. I'm sort of a conduit, a librarian. If you like me, that's cool. You know, probably the best scenario is you not bothering watching me at all, because you've already gone to these sources. You've made them a habit. You've realized that there's very worthwhile information out there that you're not getting via Fox News, via other more popular and more entertaining sources. So with that in mind, let's look at what Karl Denninger wrote in his recent piece at marketticker.org called "The True Face of Health Reform." And I'm going to read from it. I, of course, will come in with comments here and there, what did I think of it, but really I just want to make sure this information gets to you. And first of all, he starts off by quoting the New York Times, the piece that I've published up there. It's called, that I've linked to up there, it's called "Health Act Repeal Could Threaten U.S. Job Engine," which basically, in a New York Times sort of way, says we can't do anything to get rid of Obamacare because it'll cost jobs, and in the short term, some people may feel pain. And of course, behind that is the idea that Americans are too soft to absorb any of that, and they'll blame politicians, they'll blame Trump, no matter what the circumstances are, no matter what the decades worth of activity have been that have gotten us to this point. But you know how the New York Times is by now. I don't need to explain it. Here's what it writes: "From Akron to Youngstown and Canton to Cleveland, as in cities and towns across the country." It sounds like, reminds me of the beginning of ROCK in the USA right there. They come from the city, and they come from the cities, and they come from the smaller towns. Okay, with that in mind, workers who once walked out of factories at the end of each shift now stream out of hospitals. Very poetically written. While manufacturing employment has fallen nearly 40% in northeastern Ohio since 2000, the number of healthcare jobs in the region has jumped more than 30% over the same period. In Akron, the one-time rubber capital of the world, I will, because it's this time of year, point out that it's the hometown of LeBron James and also the place where Stephen Curry was born. Same hospital, in fact. Hey, that fits into healthcare, which is very ironic, given that those two look like they're destined to meet in the NBA championship for a third year in a row. Just, it's a weird coincidence. Steph Curry really didn't grow up in that area, though. The one-time rubber capital of the world, only one of the city's 10 largest employers still makes tires. 3 are hospitals. And then Denninger gets into it. He talks about, whoa, my tripod may fall. Denninger talks about, he puts his analysis here now. If these were doctors and nurses, that might be understandable, but they're not. Then there's a graphic there showing practically exponential growth in the number of administrators and basically flat growth, if any growth, in the number of actual physicians. They're nearly all paper pushers who contribute exactly 0 to actual consumer care. The problem is that all of these people draw salaries and thus drive up the cost of medical care by ridiculous amounts. In fact, last month, some 20,000 people were added to the so-called healthcare employment rolls, and nearly all of them will never provide 1 second of actual care to an actual person. But every one of them has and will massively drive up your healthcare costs. In fact, if the average, quote, administrator in that group makes $40,000 in the last month alone, makes $40,000 a year, in the last month alone, a whopping $800 million per year before their health insurance and employment tax cost was added to your medical bills, and yet not one single person got 1 minute of additional actual care out of that expense. Next month, there will be another $800 million added on, which you will be forced to pay. The next and at least as large problem is found in the continual bleeding of hospitals and similar that Medicare doesn't pay what X costs as their justification to gouge private parties. But this claim is false. If you look at many of the so-called non-profits, you can find myriad examples of this being a flat-out lie. And nowhere is it easier to find than in the hospital's lab sections. Again, I'm reading from Karl Denninger, what he wrote, I think just yesterday at the Market Ticker. Direct operating costs are usually about 10% of the revenue amounts. In other words, the hospitals are making 1,000% profit in their labs, net including all expenses on balance, that is, Medicare and Medicaid. When you look at the actual operating costs of these labs, is paying a price that approximates cost plus a bit. And oh, by the way, that's what the law governing Medicare and Medicaid requires. If private parties paid 10% more, that would be a rational profit margin. 1,000% more is a bleep job. I don't even know what the bleep stands for there. I can imagine, but I'm not 100% sure. This is why alleged non-profit hospital administrators frequently get 7-figure salaries even when they're associated with a university system where the head of such school makes 1/5 to 1/10 as much. But do they make as much as the football coach? That's the question. This is why alleged non-profit hospital administrators frequently get... Oh, wait, I just read that. He goes on, no competitive business can maintain 1,000% net profit margins in any segment of their business for any length of time at all. Because as soon as someone figures out that you're making that sort of profit, they come in and open a competing business. It will happen every time, simply because the new entrant can undercut the other guy by half on price and still make 500%. There will be dozens of new business entrants within days. The only way to keep that from happening is to do anti-competitive things, such as conspire with others to fix prices or form networks that forcibly lock out competitors. All of those acts are illegal under law that has stood for more than 100 years, yet both state and federal governments refuse to enforce said laws. We can solve the health insurance problem in a literal day by enforcing those laws against everyone in that sector of the economy. But if we do so, then the 1,000% profit margins collapse by at least 90% in an afternoon, and along with the screwing on the billing end goes a lot of jobs. That's a great point there. I mean, this is sort of quasi-government jobs, isn't it? That's the, government as a job creation vehicle for party loyalists, right? Think about Michelle Obama's so-called job that she was getting $300,000 a year for with the University of Chicago health system. Google that if you don't know about it. Healthcare collapses as a share of the economy from over 19% today back to about 3 to 4%, and this is recognized as the mother and father of all recessions because it will be, again, otherwise known as an economic correction. That recession won't last long, though, because with the amount of money that now remains in consumer pockets instead of being stolen through extortionate health insurance schemes, America becomes the most competitive place to run a business in the Western world. We would see an enormous influx of firms to the United States beginning within days, and it would not be long at all before all of the jobs displaced would be recovered and then some. If you want an example of what this would look like from the economic point of view, have a look at 1920-21. Which, of course, was in the aftermath of World War I, but I don't know if that was the primary driver in 1920-21. And Europe was devastated at that point, so U.S. companies were in a particularly strong position. Denninger goes on, but the fact of the matter is that those who would lose during that transition whine big, they whine loud, and they lie. He probably should have added payoff politicians as well. They scare you with knowingly false claims that you'd have no doctors, nurses, or hospitals, and thus would die. This is trivially seen to be a bald-faced lie when one simply looks at the growth of administrators versus physicians in medical practice. That's the chart I mentioned before, in which you should really click onto the link so you can see it for yourself. The latter actually diagnose and treat persons, the former do not, and if nearly all of them disappeared tomorrow, there would not be any impact on the number of physicians and nurses, and thus there would be zero impact on the ability to deliver medical services either. If you get the force, fraud, and extortion out of the medical system at all levels, from pharmaceuticals to hospitals to the local imaging center and testing company, you'd find that most of these administrators would lose their jobs. Under a competitive market, they would produce far less in value than they cost. Indeed, you only need to look at the quarterly filings for virtually any public company that operates in a competitive market, and you will find that SG&A, that's sales, general, and administrative expenses, typically runs about 10% of revenue, and most of that is G&A, general and administrative expenses. Businesses in a competitive market can't spend more because if they do, someone will come in, compete with said firm, and destroy it by cutting their prices. Really competitive business, for example, Amazon, have G&A costs of about 2% of revenue. That's how they hammer their competition and how you get better prices. They keep their costs down. Now look at any of the healthcare public firms. Aetna, for example. Their G&A is 23% of revenue, and the only reason they get away with it is that they are protected from competition. In other words, they blow 2.5 times what a business in a competitive market does, and 10 times what Amazon does on administration as a percentage of revenue without fear. Because they can, without having their head cut off by a competitor. And oh, by the way, there's plenty of creative accounting too. Health-related firms have every reason to understate their actual G&A expense, lest the pitchforks and torches come out. We will never get healthcare under control, nor will it ever be affordable until and unless the underlying issue, cost, is addressed. And that's a huge thing with Denninger. He writes about healthcare a lot, and he pretty much always mentions cost as the biggest issue. Cost is only addressed through market forces, and that means enforcing the law by hammering every single anti-competitive agreement and practice that these companies engage in. If we do that, the cost of medical care will drop like a stone, 80 to 90%. There will no longer be a pre-existing condition problem because for virtually every situation you will be able to pay cash. For the few where people literally cannot, because even when the $90,000 annual cost of treatment is $500, as is the case for many MS patient drugs if you buy them outside the US, our social safety net can afford $500, but not the $90,000 tab that escalates at 10% or more a year. In the case of people with type 2 diabetes, the cost of treatment for most of them would drop to an actual zero were they to stop eating carbohydrates rather than green vegetables. That sounds like a hard sell given how many people like pasta and pizza, unless you explain to the 250 or 400 pound diabetic that if they do this, not only do they spend zero on meds, in addition, all their extra weight will come off without being hungry or exercising to death, and they won't have a heart attack, stroke, or destroy their hips by trying to carry an extra 100 plus pounds around either. What will said type 2 diabetic choose if the options are 1, pay for testing strips and medication out of his pocket, albeit at a much lower cost than today while eating pizza, or 2, pay 0 for testing strips and drugs because you no longer need either, but don't eat pizza. The obvious choice is to eat the steak, forego the pizza, and as a result drop both the medication and the extra 100 plus pounds while keeping the money you used to spend on meds and testing supplies in your pocket. Those who are screaming about pre-existing conditions and similar have a choice to make. By the way, I've seen some people have changed their profile picture on Facebook to "I have a pre-existing condition," which of course means, so how dare you support any reform of Obamacare, which of course was probably designed from the start so that you would be evil and insensitive if you were against Obamacare once it had been enacted, and some people got used to it. It certainly is to the benefit of some people. The choice that has to be made is the following. You can either continue to support the blatant rip-off of the current medical system in this country, which thus compels you to argue for stealing from others, or you can argue for putting the monopolists and extortionists in prison using existing 100-plus-year-old law, which will collapse the cost of your medical care by 90% or more in an afternoon. He's talking about antitrust laws there. Oh, and one of those choices can't work because there simply isn't enough money to continue doing it, no matter who you steal it from, while the other both can work and will after the adjustment in the economy takes place. It will lead to much higher productivity employment throughout America. That choice, if you take it and demand that it happen right here, right now, today means your wages will go up, your cost of living will go down, and your life will dramatically improve. Last paragraph from Denninger, as he wrote it here. If you take the other choice, to either sit on your hands or make more and more demands for single payer, which of course is the Cloward-Piven sort of, or is the Cloward-Piven strategy that the healthcare system will have to fall apart, and then the government will have to come in and step in the process, get full control over people. There's no better way to get control over people than via healthcare. If you take the other choice, to either sit on your hands or make more and more demands for single payer and cost shifting instead of collapsing the monopolies and extortion rackets, you will not only fail to obtain the healthcare you desire, you will cause the collapse of our federal government, state budgets, and the nation's economic future. Now, I have here a few worthwhile comments to the piece. There weren't too many comments up there. I think Karl Denninger is very discerning about which ones he allows to stay up there. He only leaves up the really insightful ones. But let me read them to you. The ones that I thought were most worthwhile. Was just wondering what the definition of physicians is. For instance, is it only MDs? In Canada, we have nurse practitioners who do many of the tasks an MD does, but not all. Also, what about a nurse, an RN? Are they included in physicians? I would expect not. Anyways, defining physicians would help one better understand the graph. Again, you got to see that graph. Nonetheless, the graph still makes quite a statement about too many paper pushers. Amazing. Another comment. I've always felt that nonprofit was one of the most misleading terms in existence. What it really means is that management does not have to satisfy stockholders or worry about a stock price. That way, management can keep more of the nonprofits for themselves. Does anyone else feel that our country has turned into one giant scam? Someone else responds, and this is also about the nonprofits. That reminds me of a comment I first read in the 90s by Lester Thurow, a Democratic Party economist. The difference between a for-profit hospital and a non-profit hospital is that a non-profit pays out its profits as salary. Someone writes, Parkinson's law, that work expands to consume the time available to do it, has a corollary. Bureaucracy, oh, I totally agree with this. Bureaucracy expands to consume the money available to pay for it. Only cure is to cut off the money. And then there's an interesting graph here. Look at the slow escalation of the fraud. This is the graph again that I've now referred to about 5 times that is very worth your seeing. Interesting graph. Look at the slow escalation of the fraud, then look again at its double leap around 1987 and again in 1991. Amazing what anti-competitive practices can do, especially when laws are not enforced. From the graph origin, when the current rendition of the current medical insurance scam started to come into play. This is the game that companies played to initially beat wage and price controls under the Nixon administration. By offering such employer health care as part of the benefit package, did it actually help employees? It was initially thought by offering benefits that would be underutilized, that would keep money in the company's pocket. Little did they learn. Did it work? No. Since it was such a commodity, the price started to escalate. Everyone has it forced on them. Everyone was now grouped into a policy. The good risks made to suffer with the bad risks. Don't have the insurance, and a simple hospital bill could leave you bankrupt. Then they found new reasons why people should use the medical bleep system. I think they mean medical bleeping system. Annual or 6 months checkup, blah, blah, blah. It is an excuse to create a revolving door of escalating costs as the system is being used even more. Honestly, how many times has a doctor caught some type of life or quality of life threatening issue that the patient didn't realize something was wrong from the start? He might diagnose a reason, but it's kind of like taking your car to a mechanic for an annoying squeak or engine fail light. Then we have the probability game of early detection. I'd like to see the odds for that one from the House Casino Manual versus the actual cost to the consumer. Who is winning here? Let's look at breast exams. Some sources say they are actually harming women and driving up the probability of cancer due to the testing schedule. Once the medical piggies had a captive user population, no longer was the value of that policy hid from government as part of wages. They were also hidden from the public by not posting prices. Surprise, here is your outrageous bill. The providers then collude with the healthcare providers to make sure all the people needing medical care were now groomed to feed their ravenous greed. By letting you purchase insurance from them, they are doing you a favor. This is what happens when the laws are not brought down like a hammer. at the very beginning on those that would cheat the public through collusion and anti-competition. If enforced from day one, the embezzlement would not have been big enough to cause a recession issue. This is total failure of government and elected officials and the people to hold them accountable. Now I just want to quote a little bit of the article that at the end of his article, which I'm primarily talking about here, that Karl Denninger says you need to read, as it's called The Bill to Permanently Fix Healthcare for All. And this is also by Karl Denninger. Let me just read you 2 paragraphs. Hopefully it'll get you interested enough to read the whole thing. Almost done, by the way. Thanks for bearing with me if you have. Wholesale drug pricing in the United States must be on a most favored nation basis. This is, by the way, 2 of just many bullet points, and these will just catch your attention. I think they're good examples, even though they're not the primary drivers of how to fix the healthcare system. They're just 2 bullets. Again, wholesale drug pricing in the United States must be on a most favored nation basis. The impact of this would be to force a level price across all nations for drugs produced by any pharmaceutical company marketing both in the U.S. and anywhere else in the world. Violations, including attempts to offshore via subsidiaries to evade this requirement, are deemed criminal and civil acts. The civil penalty shall be 300% of the difference paid to the customer who got screwed, and another 300% for each instance of a prescription filled at an inflated price paid as a fine to the government. This would drive drug prices down by at least half in the United States, and for many drugs by 90% or more. It would instantly and permanently end, for example, the practice, I like this example, especially because I was just in the Southwest, near the Mexican border, well, a month and a half ago. The practice of charging someone $100,000 for scorpion anti-venom in Arizona when the same drug from the same company is $200 for the same quantity 40 miles to the south and across the Mexican border. Since all prices must be posted at the retail consumer level for both goods and services, controlling the drug pricing problem at a wholesale level is both simpler and sufficient, since competition will already exist at the retail pharmacy level. And then his other bullet point, again, these are just 2 of many he has up there, pretty much all of which are interesting. No government-funded program or government-billed invoice will be paid for medical treatment where a lifestyle change will provide a substantially equivalent or superior benefit that the customer refuses to implement. The poster child for this is type 2 diabetes, where a cessation of eating carbohydrates and PUFA oils, with the exception of moderate amounts of whole green vegetables such as broccoli, will immediately, in nearly all sufferers, return their blood sugar to near normal or normal levels. All right, I've given you more than enough to hopefully convince you to read the links by Karl Denninger that I put up there, and you probably want to read the New York Times article just for background. Thank you for watching.